A new international study finds that there may be over 2 lakh deaths from malaria in India. This total is many times higher than current estimates. The study on adult and child malaria mortality in India, published in the prestigious British journal The Lancet, was undertaken to estimate plausible ranges of malaria mortality in India, which is the most populous country where malaria remains a common problem. The study is based on the premise in India. Current national malaria figures are misleadingly low because they are essentially only reporting on the recorded malaria deaths from among those who reached a health facility, were diagnosed with malaria and received treatment. And since malaria is a disease which once treated is easily curable, the National Malaria Program observes only about 1,000 malaria deaths per year. Thus, the estimation of malaria deaths using data from hospitals where malaria is cured easily with treatment would tend to miss most malaria deaths. Since in India most deaths occur in rural areas and occur at home, deaths which are noted as having high fever, a key symptom of malaria, are usually not diagnosed as malaria at a doctor's office or clinic. Further complicating the issue is the fact that malaria and other causes of fever which end up killing are often confused. To get around these problems, the researchers work closely with the Registrar General of India to introduce a unique and careful method of interviewing people, usually a family member, about how a death occurred. This method is called a verbal autopsy and can determine the probable underlying causes of death. The study undertook a retrospective national review of 1,22,000 deaths during the period 2001-2003 in 6,671 areas that resembled all of India. A large team of 800 trained government surveyors known to people in these areas interviewed families, asked specific questions about the death, and recorded a written narrative of each death. Specific questions were asked about the presence of any fever preceding the death, whether it was prolonged, severe, or associated with shivering. At least 2 of 130 specially trained physicians then assessed the probable underlying cause of death, with each record being checked by the other physicians for disagreements on the cause of death assigned. Coders assigned unattended fever deaths to malaria, usually where the fever had a sudden onset with chills or shaking. The data showed that 3.6% of the deaths were from malaria between ages 1 month to 70 years. Nationally, that figure would amount to 2,05,000 malaria deaths. 90% of these deaths were in rural areas, and the majority, 86%, were not at any health facility.
In the absence of other diseases, Indians have a 1.8% chance of dying before age 70 from malaria, but in Orissa, that risk is over 12%.
The study raises several issues. The figure of over 200,000 malaria deaths is of a much higher magnitude than the current national or WHO estimates of 15,000 deaths annually for the country. Malaria killed about 50,000 people below the age of 70 years in Orissa alone, about 20,000 each in Madhya Pradesh and Jharkhand, and 16,000 in Assam and the northeast states. Malaria killed not only 50,000 children below the age of 5, 30,000 between the ages of 14 to 15 years, and 1,20,000 between the ages of 16 and 69 years. The study noted that there were about 1.3 million deaths before age 70 years nationally from fevers among rural people who never made it to a hospital. Of these 1.3 million deaths, malaria is a significant minority. But in some states like Orissa, malaria deaths are a big part of these rural unattended fever deaths.
Our Keonjhar district is malaria prone because of its geography, that is, it is surrounded by deep forests, rivers, rivulets. However, Government of India and our state government has provided the second line of drugs, which with this we are working in cancer.
Malaria deaths were common in the same districts where the spread of malaria was high, as recorded independently by the National Malaria Control Program, or where household reports of fever in the last few weeks were high. Also, malaria deaths in these homes occurred in the same states where clinical deaths that were confirmed as malaria occurred. Finally, the most common conditions that can be confused with malaria, such as dengue or typhoid fever or infection of the brain, occurred in states where malaria was less common. This new study suggests that in the light of these findings, the current low estimates of malaria deaths in India and even worldwide should be reconsidered. The study raises the worldwide total of adult malaria deaths considerably. If in fact malaria is killing adults also in Africa, then the real worldwide total could be much higher than currently estimated. The study also points out the need for more rapid access to life-saving malaria drugs, in particular the new type of artemisinin combination therapies.
एप्रिल मास ठारू एप्रिल 1 रु अद्यावधि मु गत वर्ष 12,000 पेसेंट देखी आज सिंगल डॉक्टर किंतु वर्तमान सुधा 6,500 पेसेंट देखी तेणु पेसेंट रेट कमी.
Unlike AIDS or cancer, malaria is not only treatable but it is curable. Malaria treatment drugs used now in some parts of India, the study suggests that they can be used much more widely to save lives.